Welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we tackle the topic of the day fast and get you the take-home points you need so you understand the issue and are ready to either fix it or ask the right questions at your next dermatology appointment. Let's get started. Today, I'm going to be talking about the basics of fillers. So what are fillers? Fillers are substances that are injected into the skin of the face, typically the lower face, to help fill lines, wrinkles, and shadows and replace lost volume. As we age, we lose volume in our face, and fillers help restore a youthful appearance. They can also be used to enlarge the lips. Years ago, we had cow collagen and also a human form of collagen to inject. But in the early 2000s, we had a breakthrough and we got hyaluronic acid fillers. The first one approved in this country was Restylane, and there have been so many more added after that. There are many brands. There's Restylane and its entire family of fillers. There's Juvederm, there's Voluma, Volbella, there's RHAs, there's Bellatero, there's many different brands. And in this episode, we're just going to go over the basics of all hyaluronic acid fillers and not do a deep dive on the differences between the different types. We can save that for another episode. So first, I want to go over answers to common questions that patients ask at the consultation. How are fillers administered? Fillers are injected in a quick office visit with a very small needle. Secondly, does it hurt? And the answer to that is yes, a little bit. It hurts a little. Most patients will do a topical numbing cream, but there are patients who will do it without, and it's slight discomfort. The next question is, how long do fillers last? And the answer to that is variable. Some of them last 6 to 12 months. There are fillers, hyaluronic acid fillers, that are FDA approved for up to 24 months. So it can be variable depending on the area of the face and the type of filler. Sometimes patients ask, at what age should I start? And my answer to that is I've really done fillers from 18 years old all the way up to in the 90s. It can really be any age. There's no set age when you start. It's very patient dependent. Patients are often asking about side effects. What are the side effects? The main side effect is bruising, which is common because fillers are injected with a needle. I always warn people not to do fillers the week of a big event. You want to do it in advance in case you have a bruise or some swelling so that it can calm down. In addition to bruising and swelling, you can also get some bumps from fillers. These are usually temporary. They often go away with massage. The nice thing about hyaluronic acid fillers is that they are reversible. If you have a bump that persists, we have an enzyme called hyaluronidase, which we can inject and just dissolve the bump. And that does dissolve the filler, so we only save that for if it's really necessary, which is very uncommon, but it really puts a lot of people at ease to understand that this is a reversible procedure. Another side effect that people worry about is discoloration. Discoloration is rare, but it can happen when the filler is placed a little bit too superficially or somebody's skin is just very thin or very pale, and you can basically see the filler reflecting the light and it looks a little bluish or greenish in the area of the filler. This is called the Tyndall effect. Nice thing about this is completely reversible. You could just dissolve the filler and this problem goes away. So far, all the side effects that we've talked about either go away or they are reversible. And I'd like to mention two extremely rare but bad side effects that can happen to patients from fillers. One is blindness. If the filler goes into a vessel that goes to the eye and blocks it, you can have blindness, and that is obviously a medical emergency. And the second is skin necrosis, which is the same thing if the filler, which is a gel, gets into a blood vessel and blocks an area that doesn't have collateral circulation. Basically, you can make a little area of the skin die and it basically gets all inflamed and then becomes black. It does eventually heal. It is rare to have scarring, although this can cause scarring. And these are two incredibly rare side effects. There are patients who hear about the incredibly rare bad side effects and they don't want to do fillers, and that is absolutely fine. But if the rest of the conversation sounded good to you and you understand that the rare side effects are incredibly rare, fillers are extremely safe and helpful and beneficial for making people look younger and more refreshed, and it can be done very naturally. So this brings me to the last thing that patients are very commonly asking me about, which is that they are concerned they're going to look weird. They say, "Doctor, I don't want my cheeks all blown up. I don't want duck lips. I don't want to look like the Joker." They don't want puffy smile lines. They've seen people basically with bad filler jobs, and they're concerned that they're going to look that way. And that brings me to my next subject, which is finding the right injector. Those bad filler jobs that you see either on TV or a friend or a neighbor, it's really not the product, it's not the filler, it's how it's being injected, it's the technique that's being used, the amount that's being used. So it's really important to find yourself an injector who shares your vision for what you want to look like. And most people just want to look like themselves. Just younger, turn the clock back 5 years, maybe even 10. Just look refreshed, look like they've been on vacation. They don't want to look different. And it's fairly easy to do that with an expert injector. And my suggestion is that you check for somebody who is board certified, somebody who's board certified in the appropriate specialty, such as dermatology or plastic surgery or facial plastic surgery. And also to look at the person who's doing your injections. Do they look natural? They're honestly often injecting themselves. How about the staff in the office? They're almost always injecting their staff. Does the staff look good and natural? Is that how you want to appear? Check their before and after photos. Check their reputation. Check their website. Check their credentials and do a lot of research. And if you're not comfortable, obviously, don't do it. I would say all in all, in the right hands, for the right patients, with the right injector, fillers are incredibly helpful to help people look younger and more natural. It's really about aging gracefully, and they do a fantastic job. And we have so many of them, and they're extremely versatile. And I absolutely love helping my patients with fillers. So in summary, the fillers that we're talking about here, which is the majority of the fillers on the market, are hyaluronic acid fillers. They are easy to inject in a quick office visit. The main side effects are really swelling, bruising, occasionally a bump. All these side effects go away. They are reversible. Fillers do an incredible job, particularly in the lower face, although they can be used in other areas, to help turn back the clock, reduce shadowing, reduce lines and wrinkles. They can be used to enlarge lips. They can be used to help lift up the cheek. They're very versatile, they work incredibly well, and they're very safe and effective. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative about the skin that you're in and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking to you again in the next episode.